Hello, everyone. Welcome. Thank you for being here. This is Managing Stress and Cultivating Emotional Resiliency in the Time of COVID-19 and Black Lives Matter. This is the second in our series of presentations on promoting positive change in times of COVID, which we at the Center for Excellence in Collaborative Education are co-sponsoring with the Planetary Health Alliance here at UNE. I'm Chris Hall. I'm the program manager for the Center for Excellence in Collaborative Education, otherwise known as CC. We're very glad to have you here. And I'm just going to review the etiquette pointers very quickly. Please remain muted and stay comfortable. We hope that you will listen carefully and be engaged. There's a lot of opportunities for feedback in this session. Always when we're working collaboratively, we try to assume best intentions on the part of everyone who's participating. We'd love to see your thoughts and comments in the chat as we go through. And we do have a chat moderator who will be bringing your comments forward. And if you have any questions, you can private message myself or Michelle Cody or Sandra Scipoletti. You'll find the names in the participants list if you have any individual questions. And if we start to glitch, just say something in the chat so that we can rewind. We want to start out with a poll, and then I'll introduce our presenter. So you want to open a tab, another tab in your browser or on your device of choice, your handheld device of choice, and you want to direct it to pollev.com/CECE 2020. It's not case sensitive, so you can just type that right in, and it's at the top of your screen too. And I see some folks are getting the hang of that. And we just want to know what you're studying here at UNE so that we know who's in the room, and we can acknowledge the expertise that's here with us, because each of you brings a particular point of view. It's great to see physical therapy, pharmacy. Thanks, Anne. Do you want to go ahead and mute yourself? Thank you. This is fantastic representation. I see ABSN. James, is that you as the pre-health advisor? Strong showing from occupational therapy and medical. Thanks for being with us. Oh, and speech language, nice. And some public health students. So thank you so much. And when you're in the chat, we would love it if you would identify yourself by what you're studying so that we can learn about from and with each other that way, since we're not able to be together in person. So now I'd like to introduce Arabella Perez, faculty in the School of Social Work, who is going to bring the content to us today. And thank you so much for participating in the poll. There will be a few more polls going on. So Arabella, do you want to go ahead and take it away?
Great. Thank you, Chris. Welcome, everyone. It's great to know that you're there. I can't see all of you, but it's nice to know that you're on the other end here in this virtual space. And I am pleased to be spending the next 55 minutes with you. And I just really quickly want to just set the tone, just to give us some space to recognize what we're going to be talking about the next 55 minutes. We've already done those introductions in that you've been able to identify what professions you represent. And then, hello there, Annie. And then in addition, I'm going to be introducing myself, and then I'm going to have Laura, who's my chat moderator, who's also one of wonderful trauma-informed certificate students introduce herself. So we'll introduce ourselves to you. And then from there, I'm going to go right to a discussion of stress, collective trauma, the neuropsychological responses to the pandemic, cultivating skills, and then really end with a new way of being, which is just sort of summarizing what we've been talking about. It's a lot to cover in 55 minutes, so I'm not going to pretend that I'm going to cover all of it. I really want to focus more on skills. So I will do my best. Please use the chat box at any point in time to just identify a question or a comment or reflection that you want. And that's the role of my lovely chat moderator, Laura, is to collect all of that and synthesize that information so that I'll have an opportunity at the end to respond. And if I can't respond to all of it, I'm more than happy to respond via email, just being able to pass that information along. And many of you know where to find me at Hersey on the 4th floor in the social work department. All right, so the next slide then. So this is who I am. And as I mentioned, I'm located in Hersey. That means I'm a social work faculty. And I am an assistant clinical professor. I've been here with the university for 5 years now. I'm also the coordinator of the trauma-informed certificate program that is currently only open to social work students. That being said, I do teach a course on empowering cultural education. I've had the honor and the privilege of having both occupational therapy students and physical therapy students attend that class. So I'm really enjoying getting to know the other professions. And my hope and dream one day is that that certificate for trauma-informed care will be open to all of the disciplines. I'm a firm believer that all of healthcare needs to be doing this work through this particular lens. And I'll be weaving that in and out of this presentation. And finally, I'm a national consultant on trauma-informed care. So during the pandemic, I've actually been busier than ever, in that so many organizations, both in the state of Maine and outside of the state of Maine, have been contacting me, asking for assistance on understanding toxic stress and how it's impacting their organization, how it's impacting their employees, how it's impacting their community. So I'm pleased that I'm able to offer my passion to other individuals. So that's who I am. And the next slide is Laura. So if Laura can unmute herself and share a little bit about who she is, I'd love to hear her voice.
Thank you so much, Arabella. It's so great to be here. I am an MSW student and a candidate for the trauma-informed certificate. I also work at Good Medicine Collective, which is just an innovative collective trying to find different ways for people to integrate alternative health practices. I'm also a qualified mindfulness-based stress reduction teacher, so that makes me even more excited to kind of see this beautiful presentation Arabella has with us. My role as the chat moderator, as Arabella said, will just be to integrate your voices if they're not auditory and you would rather do it through chat. I'll be here to kind of bring those voices forward. So any questions you have, any comments, please feel free to put them through the chat. Once again, I'm grateful to be here. Thank you. Thank
you, Laura. Thank you so much. All right, so we'll move on to the next slide here. And Chris.
So this is another poll. If you're logged in, this should come up automatically for you. And we want to know how you're feeling today. And just click on the otter that speaks to your inner or outer self as you wish to share it with us.
And what I love about this otter scale is that I'm not here to tell you what these otters represent. I find it much more interesting how you sort of interpret these otter faces. So I would say that for me right now, as I look at these otter faces, oh, wow. Oh, I'm seeing people are loving A and B. I'm feeling a little bit like the F. Not quite sure what's going to happen in the next 50 minutes, but I'm up for something. Yeah.
Yeah, I was feeling D pretty hard today. Like being on the scale is representative of so much.
Yeah.
Days.
So it looks like B and A are the top ones, huh?
Mm-hmm.
Fascinating. Yeah. Okay, so we're going to assume that A and B might be a little playfulness there, a little bit like what the heck is happening, perhaps feeling a little stress in that A. So thank you all for participating. I really appreciate that. All right, so we're going to move on to the next slide here. So we had a little bit of fun there with the otter scale, because who doesn't need a good otter? I know I've been surviving on puppy videos lately, so that's been my self-care. But now to take it a little seriously, what I really would like to hear, and again, not being able to hear all your voices in this space, but at least these polls allow me to get a sense of what's happening, to take a pulse of our community. So what is your average level of stress? And it's a Likert scale, with 1 being totally cool and 10 being wicked stress. So thinking about your average level of stress, perhaps in the past, week or 2 weeks. So lots of numbers coming in. I love seeing how the numbers keep fluctuating like that. So we definitely have some folks here that are landing in the 4, which is more of that sort of neutral space, and definitely some wicked stress, that 10. Yeah. Yep. And then we have that 6. So it looks like some of you are sort of comfortably in that mid-range of 4 to 6. And there's others of you that are feeling that wicked stress. So thank you so much for participating in that. So let's go to the next slide. So what I want to do now that I sort of put you in that place of reflecting on your stress, what I want to be able to do is now help you manage some of that stress. So what I enjoy about doing these presentations, and I've been doing one of these almost every week to different organizations, is teaching you some skills. So what I'd like to now do is move us into a breath and body awareness activity before I go into that didactic sort of PowerPoint portion of this presentation. And because I practice trauma-informed care, one of the things that I'm a firm believer on is choice. So you have a choice here as to whether or not you'd like to participate. And you can always shut your video off if your video is not shut off so that folks don't see you. And you can just listen to the sound of my voice and not participate in the activity, or you can go ahead and participate to whatever level of comfort you have. So what I'm going to invite all of us to do, because we'll be doing this activity for a few minutes, I'm going to invite you all just to come into your space. So whatever your space means to you. So whether it's a chair, a couch, sitting on the floor, just coming into that space. And as you come into that space, just bring some awareness to your body, drawing your shoulders down and away from your ears, noticing the quality of your breath as you breathe in and out. Perhaps your eyes are closed or cast downward. Just, again, breathing in and out. Just being really curious right now about your body. And as you do that, and as you begin to bring attention to your body, tapping into that body awareness, sinking deeper into your seat, noticing how the ground supports you, breathing in and out. And what we'll be doing for the next minute is left nostril breathing. So when you're ready, and if you have to look at me first to do that, you can look at me to see what I'm doing. What I'm going to have you do is lifting up your right hand to cover your right nostril. So you'll be covering your right nostril, and you'll be breathing in and out through the left nostril. So covering that right nostril and breathing in and exhaling through that left nostril. Breathing in and out, all the while covering that right nostril. Inhaling deeply, exhaling completely through that left nostril. And I will cease my chatter and just invite you all, if you'd like to go ahead and practice left nostril breathing for the next 45 seconds. And then when you're ready, you can go ahead and release your right hand and just resume your normal breathing, or whatever's normal for you, breathing in and out. And if your eyes were closed or cast downward, you're invited to open your eyes, look back up at the screen here. And I thank you all for either listening or engaging in that practice. And before I move on to the next slide, I just want to speak a little bit about left nostril breathing and what it's doing for you right now. So one of the things, and I at the end, I will share this book. It's called Breath, The New Science of a Lost Art. It just recently came out. It's a fabulous book, and I have other books. This is the one that's by my bedstand right now. But I've been doing breath work for the past 6 years and understanding how breath helps us understand the balance between our sympathetic and parasympathetic nervous system. So what is that? This is sort of my quick and dirty here. Think of your right nostril as the gas pedal. So when you're inhaling primarily through that right nostril, your circulation speeds up, your body gets hotter, your cortisol levels increase, as does your blood pressure and your heart rate. And this happens because breathing through that right nostril activates the sympathetic nervous system, which is your fight-flight mechanism. So breathing through that right nostril will also feed more blood to the opposite hemisphere of the brain. So the right nostril connects to the left hemisphere of that prefrontal cortex, which is associated with logic, language, and computing. All right. Inhaling through the left nostril, which is what I had you do, has the opposite effect. It's the brake. So I think of it this way: right nostril, right leg, gas pedal. Left nostril, left leg, brake. My mother used to drive that way. I'm not advising that you do that, but that's an easy way to remember it. So your left nostril is your brake. It's more deeply connected to the parasympathetic nervous system, the rest and relaxed side that lowers your temperature, lowers your blood pressure, cools the body, and reduces anxiety. Left nostril breathing shifts the blood flowing to the opposite side of the prefrontal cortex. So now it's flowing to the right side, which plays a role in creative thought, emotions, formation of mental abstraction, and negative emotions. And here's the thing. Have you ever wondered why we don't have one nostril, we have two nostrils? I know this used to keep me up at night, just joking. But anyway, our body operates most efficiently when we're in this state of balance, pivoting between the action and the relaxation, the daydreaming and the reasoned thought, okay? So flowing between parasympathetic and sympathetic. So I invited you all to do left nostril breathing just to come more into that relaxed state, knowing that I had just a minute ago asked you to reflect on your level of stress. So for some folks, especially if you were a 10 or a 9 or an 8 or even a 7, that could have been potentially dysregulating for you. So just engaging in 1 minute of left nostril breathing, it's something that I always do before a presentation or before something that I know is going to require some courage on my part to have a courageous conversation, perhaps to have a courageous conversation around the social unrest that we're experiencing. Then I'll practice a minute of left nostril breathing. So that's a skill that you can try on at any time. Right, next slide. So I'm going to be talking about stress. Let's go to the next slide here. And when we talk about stress, the good, the bad, and the ugly. So when we think about stress, stress is really a continuum. And I always start off by talking about eustress, which comes from the Greek, and that's good stress. So eustress versus distress. So good stress are things that we actually want to experience. When I think of good stress, for me, good stress is when I was a graduate student, being in school. That was good stress because I knew at the outcome I was going to have a degree that would enable me to do work that I love doing. So studying for those tests, passing the exam to be a licensed clinical social worker, those were examples of good stress. If anyone's planning for a wedding or planning for the birth of a child, those are examples of good stress. So you can read what's up here. I just want folks to understand that stress is really on that continuum. So you have what's good stress, and then you go all the way to what we would consider to be distress. And distress can lead to toxic stress. And that's that psychological physical tension, where you're feeling dysregulated, where you're not having that flow between the sympathetic and parasympathetic nervous system. And it's that general lack of ease. So I'm sure as I'm talking, you can probably think of examples of things that are distressing. Certainly the pandemic will be an example of that. And for some individuals that on that scale of 1 to 10, perhaps we're more in the 4, 5, and 6, it may not be as distressing as it is for people who are feeling a 10 right now. That's when I would be worried about toxic stress. And that's that stress that builds up in the body. And then we also have worry. And what's interesting about worry is worry really, and there's a link here for you to go to, worry really is about those thoughts that we have. And worrying can actually be productive until it's taken too far. So I know that when the pandemic first hit, my worry, and I'll just say it, maybe some of you are also worrying about the same thing, was where am I going to get toilet paper? That was my worry, and I can laugh about it now, but at the time, these worries felt very real to me. How am I going to keep my family safe? How am I going to have access to masks? These were the things. And that worry, as distressing as it was, it also got me to think about solutions and to think about how I would go through the day to figure out how to access those resources. So that's the thing about worry. Often we use that word and folks think it's a dirty word and we don't want to talk about it. But all of these words, there's the good, the bad, and the ugly with all of it. And then finally, there's the anxiety, which happens when that worry and that stress merge into that 24/7 state, right? And I know for me, that's something that I certainly struggle with trying to determine when am I going to get into that range of anxiety. And if we go to the next slide, the reason we talk about this is that we certainly are right now a pretty anxious community. So you can look at the stats right here. Stress and anxiety are in fact on the rise. And this is from the American Psychiatric Association. And you can read the stats right there. And then really looking at that last one in particular, how anxiety or depressive disorders jumped from 36 to 41% in the week after the video of George Floyd's murder. And how public that became, especially for Black Americans. So it's important to recognize that anxiety and stress have been on the rise for quite some time. For those of us that are in academia, we know that. For those of you that are students, you likely either experience that or know of your peers who are experiencing this. And because of the pandemic and the fact that we're in the social movement, anxiety and stress are even more on the rise. All right, so next slide, please. So continuing this theme of how it's on the rise here, so in addition to all of that, COVID-19, thinking about that and how that also contributes to our experience of stress and anxiety. And there certainly are other contributing factors there. And again, you can read many of the slides that are listed there. And as you read those, you might be having some reflections on your own experience or those of friends and loved ones. Next slide, please. So here I'd like to move into what are those psychological responses that individuals have been experiencing during this pandemic and the social movement, Black Lives Matter. And here are some examples: stress, anxiety, anger, sadness, fear, exhaustion, difficulty focusing, difficulty remembering things. And I'll get to a slide later on that talks about why focusing and remembering is such a challenge right now. I call it the COVID brain for me. Unmotivated, burnt out. And in addition to that, for some folks, there might be a feeling of hopefulness, a burst of energy, some activism, some altruism. And I'm going to be talking about phases of disaster. And certainly there's a phase of disaster where these last 5 happen. And the last one in particular, that renewed sense of purpose, is what we call in the trauma world as post-traumatic growth. So that's where that resiliency comes out of facing adversity. So as you look at those, the next slide is an opportunity for folks to reflect and respond. How are you responding or feeling about the events of the last 5 months? And this is going to be a word cloud, correct, Chris?
Yes, this will be a word cloud. So if you connect your words with the underscore, then your phrases will hang together. And this should pop up on your in your tab or in your handheld device automatically.
So again, thinking about all of those responses, those psychological responses that I mentioned. So overwhelmed, confused, angry, uncertain, stressed, annoyed, bothered.
Yeah,
Scared.
it's change, right? Change is always anxiety producing
Yeah.
at first,
Privileged.
or in a good way or a bad way.
Yeah. And I appreciate the individual that wrote privileged. Yes, certainly that's something else that for many of us we're feeling it. I get to work from home. There's privilege with that.
Oh, Dr. Shaw got a shout out.
All right.
Appreciate that. Yeah, uncertainty for sure. And
Whole
hope.
spectrum.
Mhm.
Yeah.
So what do we do with all of this? I see empathy, which is great.
Mm-hmm.
And the awareness that it could be there are permanent changes that have occurred
Yeah.
very rapidly, in terms of like getting together like this. The Zoom is not going to go back in the box, right? That will still be a way that
Exactly.
people gather.
Exactly. Lucky. So this is incredible. Thank you all for just putting some words in there that reflect certainly what I know I'm experiencing and what I'm hearing from many of the individuals that I have the privilege of working with.
And shame, right? Being ashamed. Wow. Things are piling on. That's very much true. It's going to continue to build. So what do we do with that, Arabella? Help us.
Well, we'll keep going.
Well, are you ready?
I'm ready. I mean, I can't do all of it in 30 minutes.
Thank you, everyone, for sharing that.
Yeah.
It's very meaningful.
That was very meaningful. And again, I certainly appreciate from a trauma-informed perspective how important it is for us to be vulnerable and to share these experiences. And clearly there's some anonymity here in these word clouds, which I also love. So folks don't feel like they have to attach a name to a particular symptom or response. So I thank you for still sharing. All right, so as we move on, I'm going to talk about collective trauma next. So the next slide here for collective trauma. So before I talk about collective trauma, I thought to myself, it's really important to just do an overview of phases of disaster, because certainly what we're experiencing right now is a disaster. And this particular slide comes from a training manual for mental health and human service workers. And you can find the training manual on the SAMHSA website, which is the Substance Abuse Mental Health Services Administration website. And there are 5 phases to disaster. And it's just actually 6, I'm sorry. And it's intriguing to think about how this pandemic will likely influence and change the way that disaster preparedness and disaster responders work. So the first phase is that pre-disaster phase. So if you look at this chart here, you have the emotional highs at the top and the emotional lows at the bottom. And then the flat line at the bottom there, your horizontal line, is sort of your date line. So what happens immediately and then what happens a year out, a year plus. So with that pre-disaster here, this is characterized by fear and uncertainty. So the specific reactions a community experiences really also depend on the type of disaster. So we're defining the moment right now. We're making history. Especially with a disaster that has no warning, it can cause feelings of vulnerability, a lack of security, a fear of one's future, a sense of loss of control or loss of the ability to protect yourself from your family. On the other hand, disasters with warning can cause guilt or self-blame for failing to heed the warnings. So even though there's a part of the pandemic that's uncertain in the beginning, there were parts of it that there were some warnings there. So I'm noticing lots of folks having a range of emotions associated with the knowing and the not knowing, and the guilt and the shame and the self-blame. And I would say the same thing with the Black Lives Matter movement. The Black Lives Matter movement just didn't happen overnight. Historically, this has been a movement that started well 400 years ago. So we can't necessarily say that we're in a pre-disaster phase with that, because all the signs were there. Our history indicated that. So as we have feelings of guilt and shame that pop up for us, it certainly makes sense, because this is where we're at in this pre-disaster phase. Then we move into phase 2, which is the impact phase. So that's categorized by a range of intense emotional reactions, And again, the reactions depend on the type of disaster that's occurring. So slow, low threat disasters have psychological effects that are different from those of rapid, dangerous disasters. So right now, ours is a slow one. I don't know how low threat it is. It depends on who you are, and your proximity to the pandemic, and also your race and your socioeconomic class and what you have access to. But I say to folks, we're in a marathon, we're not in a sprint. So when I think about this impact phase is actually quite long. So as we move on to this one, and it's interesting because in the disaster literature, this is considered the shortest of the 6 phases. But for the pandemic, that's not the case at all. So I'm sure we're going to be seeing a lot of research around this. Then you have the 3rd phase, which is the heroic phase, which is characterized by a high level of activity with a low level of productivity. During this phase, there's a sense of altruism, and many community members exhibit adrenaline-induced rescue behavior. What's really interesting is I think about when the pandemic first hit and the sheltering in place order was enacted here in Maine. And once I got through my initial shock and fear and worry, I got into this place of productivity, cleaning my house, cleaning my drawers, thinking about making meals that I can bring to my elderly neighbors, noticing on Facebook, what did folks need assistance? And I know Chris is one of those with the mask making, like how can we make some masks, make some meals, donate, contribute to other individuals. This is part of that heroic phase. And then there's phase 4, which is the honeymoon phase, which is characterized by a dramatic shift in emotion, where the disaster assistance is readily available and the community starts to bond, and there's optimism that everything will return to normal. This is a hard one right now, right, folks? I think there probably are some people that would like to say that we're entering that honeymoon phase, and yet for many of us in the healthcare field, we know that we're waiting for, the 2nd wave to hit and the 3rd wave to hit. So in all likelihood, especially for those of us in healthcare, we're not in that honeymoon phase, but there might be others who are there. And then there's phase 5, which is the disillusionment phase. Yeah, this is definitely a phase that I'm in. So this is a phase here where I realize the limits of our disaster assistance. I realize the limits of our system. And it's really hard for me, and I will only speak in I statement, it's really hard for me to stay hopeful because I'm feeling discouraged and the stress is taking a toll. And certainly the pandemic and the Black Lives Matter movement together, and as a woman of color, I'm especially sensitive to this particular phase and trying to find ways to dig deep into my toolkit so that I don't stay in this phase for too long. Instead, I ebb and flow into this. But just looking at that disillusionment phase, I can't speak today. And this phase can certainly last for months and even years. And there's the last one, which is the reconstruction phase, which is characterized by an overall feeling of recovery. And individuals and communities begin to assume responsibility for rebuilding their lives, and people adjust to a new normal. So I look forward to this. And as a social worker, I think to myself, as a profession, how are we going to be part of this reconstruction phase? What can we do differently, as we come out of the pandemic and as we address the racial inequities that we have seen for the past 400 years? So those are the phases of disaster. So if you move into the next slide here, I want to talk about collective trauma. And it was important for me to talk about the stages of disaster and how disasters can be traumatizing. And I really want to state that it's not the event itself that's traumatizing, it's the reaction and response to the event. It's the resources that are available to you. That really is what sort of colors the experience of trauma. When we think about collective trauma, this is the community, this is our society. These are major events that are witnessed or experienced by a large group that can affect how people feel and act and also result in cultural shifts. So in the chat box, I'm going to be asking you to think about some examples of collective trauma that come to mind. And I see that Chris also put something in the chat box to please ID your profession in your responses, which would be fabulous. So what examples of collective trauma can you think of?
I was thinking, Arabella, as you were presenting about the disillusionment phase, that whole graphic lines up nicely with what I know about the experience of being an immigrant and refugee. and striking how the moment of impact, whatever the event was, is not the lowest low. It's the disillusionment phase is the lowest low. And boy, it can last for such a long time.
Yeah, thank you, Chris. Absolutely. So yes, the experience of our immigrant refugee, community members. Yeah.
So we're seeing 9/11 being mentioned. Thank you, Leslie. And George Floyd, certainly.
I'm seeing mass shootings also from Kelly.
And assassinations, which, any kind of murder of a figure who is public or becomes public because they were murdered.
Michelle is also saying natural disasters. We're seeing Sarah saying opioid epidemic. Alethea says climate change. Bianca says COVID-19, of course. These are great examples.
And war, conflict, societal conflict of any kind can create collective trauma. If you think about your community, we could have a collective community, a national and global community, but there are also your family or neighborhood communities that can experience collective trauma as well as collective triumph. We have a comment from Facebook from Julia saying social work and generational poverty, for sure.
We're seeing some generational poverty, death of a loved one. We do have a question for you, Arabella, if this is an okay time.
Go ahead.
All right. This is from Leslie, who'd say, I'd be interested to hear of how Arabella draws herself out of disillusionment or any negative phase. What a great question.
That is a great question. And when I get into my grounding technique with you all, you'll likely get to have a little experience of what I do as a daily practice, where I really ground myself with this call and response, just to remind myself that I'm doing the best I can and that I'm here in the moment. So staying as present focused as I can, it's very easy for me to get caught up. Someone yesterday, I did a training and someone used the word entangled. And I thought it was a beautiful image of being tangled in everything. And I know that the more disillusioned I get, the more tangled I get. And the more tangled I get, think of a knot, and I'm trying to sort of take it apart. So if I can begin to notice when that tangling occurs, and I can practice my skills of breathing and grounding and meditation, and of course, Laura's also trained in this, but thinking about yoga and ways to really practice embodiment, listen to my body. And it took me a while to do this. I was not someone who really listened to my body very well. So now I listen to my bodily cues. Yesterday, I started getting a little bit of a neck, I noticed I wasn't able to twist all the way to the right. And I also realized I was having some pretty courageous conversations with clients yesterday. So when that disillusionment happens, I have to create space for myself and breathe into it. And we don't have a lot of time to talk about post-traumatic growth, but there's so much research out there around post-traumatic growth and resiliency, sort of the silver lining theory that came out of Hurricane Katrina, where so many individuals who were interviewed talked about the silver linings out of that disaster. So I try and look for those silver linings. I try and look for those moments where I see kindness showing up. I see compassion showing up, and I hold on to those moments. So that's what I try and do. And Laura, I don't know if you want to maybe add something. What do you do sometimes, Laura?
It's just such a great question. I think we need to really share our embodied ways of dealing and just of being with it. I think for me, I really validate that my experience is the response to whatever's happening, that what I'm going through, isn't something that's like maladaptive. It's just my experience. And that really helps me, because otherwise the feeling of abandoning myself or my experience when I'm already going through so much is just, it's the opposite of what I know I need. And when I find that happening, I'm like, oh no, stay with it. You know, this is real. And not to kind of internalize that gaslighting or that minimizing.
That's great, Laura. And in one of my slides later on, I'll be talking about emotional hygiene. So let's go to the next slide here. So COVID-19 and impact on race and ethnicity here. So it's, to me, once again, I cannot help but reflect on the fact that we are in the midst of a pandemic and an incredible social movement. And I've been listening to podcasts on a daily basis. Many podcasts are sort of my favorite BIPOC individuals, which, if you haven't heard the term, Black, Indigenous, people of color, you know, activists and leaders and researchers and social workers who've talked about. It's fascinating how the Black Lives Matter movement that's been around for a while has gained so much attention. And many individuals are saying it's because of the pandemic. And because of the pandemic, we are here at home. And to Laura's point, we're having to also be with ourselves and reflect on what's happening. We no longer have many of the distractions that we did prior to the pandemic. You know, we can't just go out there and shop our blues away or go to a restaurant or just sort of mingle with folks. You know, we really have to make very conscious choices right now and think about the choices that we're making. And because we're spending so much time in this place of reflection, and perhaps not all of us, but I know for myself and folks in my inner circle, because so much time is being spent in this place of reflection, Black Lives Matter is resonating on a level that probably would not have happened if the pandemic weren't here. So in some ways, for me, there's a silver lining that the pandemic also provides us an opportunity to look at those systems that have been systemically racist, that have not worked for so many people, and to also think about what will this look like as we move towards this vision of health and wellness. So this pandemic gives us an opportunity to do that. I hate to see this opportunity be squandered. So I think for many of us in the healthcare profession, it's our call to action. So you can read the stats right here. And I think what's really important, I want to end with that last stat, because we've heard in the news about the disproportionality, but it's interesting. I was talking to someone at Tulane University who's an advisor of mine. And when she heard me say that Maine has the highest disproportionality, she gasped. She's like, how is that? So this is from June 21st, 2020, Dr. Shaw, the CDC, that highlights 27% are Black, 27%. You know, so health and community advocates have been noting for a while that BIPOC communities are disproportionately affected, especially in Maine, because this community shows up as essential workers in factories, farms, fish canneries, or migrant workers. These are work settings where social distancing is difficult, if not impossible. Additionally, it's important to note that these are individuals who are either uninsured or underinsured and may have difficulty accessing healthcare, or they might mistrust the health system for really good reason. And they're also afraid that if they stop working, they'll lose their employment and they'll be unable to care for themselves and their families. And they don't have the luxury of working from home. So that's where that privilege that someone mentioned, that luck that someone mentioned comes up. So let's go to the next slide here. So the reason I point this out is thinking about the work that we're doing. So if anyone here on Facebook or on Zoom identifies as someone who's Black, Indigenous, a person of color, likely you have a firsthand experience about this. And I would also say for folks that don't, thinking about clients that you're working with, patients that you're working with, colleagues that you're working with who are recognizing how COVID is disproportionately affecting these communities. And when we think about racial trauma here, this is just adding on to racial trauma. And here's a definition of racial trauma. So racial trauma or race-based traumatic stress refers to the mental and emotional injury caused by encounters with racial bias and ethnic discrimination, racism, and health crimes. Legacy of slavery is a moral injury. Oh, and if I have any nurses out there, let me just tell you how much I love moral suffering and the elements under moral suffering and creating moral resiliency, and how nurses, Cinda Rushton in particular, Dr. Rushton's been on the forefront of all of this. And I would love to spend more time just really spending time with colleagues and students talking about moral suffering and the elements of that. And one of them is moral injury. And for so many of us that are in healthcare, we're the bystanders, if not the perpetrators. And moral injury, to me, the greatest moral injury is the legacy of slavery and what's happened to indigenous people here that's resulted in a healthcare system that is plagued by systemic racism. So COVID demonstrates all of this clearly. So let's move on to the next slide for the sake of time. So the stress response cycle here. So I'm not going to bore you with all the science here. It's as simple as this. Something will activate you, otherwise known as a trigger. And when something activates you and your brain takes that information in, specifically your amygdala, it'll activate that sympathetic nervous system, which is that fight, flight. And the body's going to release adrenaline. Okay. So COVID, if we were in the Serengeti being chased by a tiger, that tiger is that activation, activating that sympathetic nervous system, which we want to be activated because we want to run away from that tiger. But here's the thing. Our brain is still doing this very primitive way of helping us survive and thrive by interpreting COVID as a tiger. So COVID to our brain is that threat. It's that predator. So it's releasing adrenaline, it's tensing our muscles, increasing our heart rate. And then there's this loop that can occur if we don't interrupt it. And how do we interrupt it? We interrupt it by practicing skills. So the next slide here. So what the next slide is, as a professional, what concerns might you have about your work? What are the things that you think are going to activate you if they haven't already activated you? Okay, so here are some examples. And then is this one a chat or is this a word cloud?
This is a chat.
Okay. So if you just want to type in that chat there, we don't have too much time, but if a few folks just want to put something in the chat there, what concerns might you have about your work? Not enough personal protective equipment, becoming ill, infecting patients. It's interesting. I've been doing a lot of work with organizations who are residential care workers, and their greatest fear is bringing the virus into the facility and that it would harm, if not kill, the individuals living in that facility. Yeah. So infecting family from work, not enough PPE, infecting patients. Yeah. Yeah. So thank you. So for the sake of time, we're going to keep going, but please keep putting some additional examples in there. Thank you. All right. So for the next slide here, this is just our window of tolerance. And the reason I have this here is that we're going to be talking about skills with the next slide, but understanding your window of tolerance, that right one that has the bigger yellow. I mean, when I'm feeling really good, I have a larger window of tolerance. But right now during the pandemic and Black Lives Matter, my window of tolerance is much shorter, much smaller. So I'm either in a state of hyperarousal where I'm anxious, angry, or out of control, or I'm hyperaroused, especially in the beginning of the pandemic. A lot of folks were like, I can't get out of bed. All I want to do is sleep or eat chocolate. People were talking about carbo loading, which makes perfect sense because your body wants you to carbo load because you're running a marathon. And that's what you would do if you were in the Serengeti. So this is kind of, so think to yourself, are you in states of hypoarousal? And the right one here gives you this sort of like ebb and flow that normally would happen, and to get to that place of optimal arousal where you're appropriately responsive, right? The next slide. I mentioned to you all that I was going to get at why we're having a difficult time with memory. Just know this, that our brain right now is sending all of its resources to the fight flight. It's sending our resources so that we can handle vital tasks right now. So things like memory, higher order tasks such as decision making, brainstorm, and planning are sort of being left at the end of our to-do list. We're in survival mode, hence the brain fog. Hence the forgetting, the forgetfulness that you might be experiencing. So I'm here to basically tell you it's okay to not be okay. This is the reality of what our brain is doing for us. And it's actually doing it for a really good reason. All right, next slide. So a grounding activity. Actually, I want to do the grounding activity just because I want to, since someone asked what I do, with the grounding activity, it's just going to be a quick minute. So I'm going to ask folks to once again, just be comfortable in your space, and you're going to be doing a call and response. So you're going to be saying, I'm going to be saying, where am I? And you will respond, and I won't hear you. You will respond, here. I will ask, what time is it? You will respond, now. I will ask, what am I doing? And you will say, the best I can. So we're going to do this together, and I encourage you to say it out loud, or you could say it inside, but I find that saying it out loud helps me. So let's go ahead and start. Where am I? Here. What time is it? Now. What am I doing? The best I can. One more time. Where am I? Here. What time is it? Now. What am I doing? The best I can. Just take a nice deep inhalation in. Exhale out. So being in that present moment and reminding yourself, where am I? Here. What time is it? Now. It's the present. And what am I doing? The best I can, especially as a healthcare provider. What am I doing? The best I can. So starting your day that way, ending your day that way. If you're feeling at any point in time like I need that reminder, this is my go-to. This is one of those things I do when I'm feeling disillusioned. Okay, let's go to the next slide here. So cultivating skills. So with cultivating skills, really it's about befriending emotions.
Oh, okay.
Name it, that's okay. Name it to tame it. And between stimulus and response, there's that space. Viktor Frankl, I love Viktor Frankl, Man's Search for Meaning. So figuring out in that space there, how do you breathe into it? How do you allow yourself to connect with your emotions? So let's go to the next slide here. So the next slide gets at, the Dalai Lama said it best. I can't say it better than the Dalai Lama, but the Dalai Lama really is keen on, that emotional hygiene that we need to be practicing. So let's go to the next slide here. And the next slide here is that emotional hygiene, being mindful here of our psychological health, because we focus so much on the physical hygiene piece, right? But not so much on the emotional hygiene piece. So really quickly, in terms of what these five, and you can listen to a TED Talk by Guy Winch, and he talks about this. But the first one is recognizing the emotion, taking time to step back and observing it in a really non-judgmental way. Oh, I'm angry. Okay, that's interesting, or I'm sad, and discriminating between the two. The second one is knowing what's activating you, okay? What sets you off? What are the signs that you're feeling activated? So get to know that, connect with that. Third one, connect with your body. Recognize how the feelings affect your body. I mentioned the neck. For some of you, it might be your head. It might be your chest. It might be your stomach. It might be gastrointestinal sort of issues. So recognize how it's in your body. Your body's a wonderful emotional conductor, so notice it. Manage your reactions. Reflect on how you usually react to a specific situation. And then adjust and learn. Emotional hygiene requires learning to perceive, appraise, and express our emotions accurately and training yourself. Practice, practice, practice. Okay, that's the emotional hygiene piece. So this one right here that gets at self-care, and I have the image of Mother Teresa because she really understood compassion fatigue. She wrote in her plan to her superiors that it was mandatory for her nuns to take an entire year off from their duties every 4 to 5 years to allow them to heal from the effects of their caregiving work. Imagine if we did that as a society. You get a year off, That's incredible. So in the chat box here, I'm interested to hear what practices does your profession support for self-care? So what are some of the practices that support self-care in your profession? And there's some examples listed here. So for some, it might be mindfulness, yoga, breathing, rest, talking to others, having a support group.
And maybe these practices are not taught in your professional curriculum, or they're not encouraged by your professional culture. And that would be an opportunity for you to be entrepreneurial and bring those practices to your professional world.
I'm also getting a few in the chat now. Kate says occupational balance. It's a great one. Exercise, staying active in meaningful activities, hobbies. These are all great ones. Thank you, Harrison, Courtney, Sarah, and Kate.
I always feel like occupational therapists are really great for good, practical solutions to everyday problems.
I also love the name it to tame it. I love sessions with other people where I can kind of tell on myself. That's really helpful for me, just kind of getting it out, being an honest, open human. And when other people do that with me, that can be really, really helpful.
And I think to Chris's points, this is the time to be entrepreneurial about this. One of the studies that I'm going to be undertaking is leading some qualitative and quantitative, research study that's going to be interviewing essential workers, particularly social workers, to get a sense of what self-care did they practice in the time of COVID, recognizing that to Chris's point, we do a great job of teaching it in social work, and I feel like we're going to have to be a little innovative and learn from those that are on the front line, figuring out what's working for you and how can we incorporate that into our curriculum so that we can provide this education to, future healthcare providers as well as those of us that are currently practicing.
Thank you for the feedback. There's some great suggestions in the chat.
Yeah, this one just came in, walking barefoot, grounding. That one's from Sarah. I love that one. I think nature is so healing for me too. So I relate to that a lot.
So quickly, I want to go to the next slide just because I want to give you all a resource, psychological first aid. So this psychological first aid came about in 2006. And it's interesting because it really came out of the Department of Defense. And it's an amazing model that's not just for social workers, behavioral health folks, but it's for anyone who's a first responder, anyone in healthcare who's responding to a disaster. They used this after the Boston Marathon bombing, and there's 6 elements to it. And right here, it's ASSIST. That's the acronym to remember it. Approaching the individual, stabilizing the emotions, serve their needs, inform them of the facts, support their story, and turn them toward further services. And the reason for this is that we know that the way that we prevent, we talked about an event that's traumatic, but the way that we respond to that event, the quicker we respond to it within 24 hours, the more likely we are to prevent those symptoms that then qualify for a disorder of post-traumatic stress. So this is a great resource. It's a 6-hour free interactive training that I would encourage all of you to take just to have another tool in your toolkit that's not only about yourself, but it's also about your community. So I'm going to end on that. I think the next slide just has some of well, 2 of the books. I didn't get a chance to use Resiliency, but they have some wonderful breathing, grounding exercises.
And say thank you to everyone, and thank you to Arabella. I want to honor everyone's time. We're very close to the end. This is a very thought-provoking presentation, and I hope that people will continue to think and continue to breathe mindfully through their left nostril as demonstrated. And we do have more events in our series coming up. The next one is on Thursday, August 6th from 12 to 1. And if you enjoyed the interactive portions of this, the upcoming events will also feature those. And then in the fall, we'll be working with the Planetary Health Alliance. Some of the folks are on the call today as well to present about public health and climate change and people, planet, and profits as we reflect. Hopefully we're in a position to reflect November 12th and no longer in coping mode. But I very much appreciate everyone's attendance, and I want to thank you for coming, and we hope to see you next time. And thanks to Arabella and Lara for your time and energy presenting with us. And I hope you'll have a fantastic day.
Thank you all.